Assalamu alaikum wa rahmatullah. For this session, we will discuss the major arteries and major veins in our body. So take this diagram and see how the arteries are coming out from the heart and supplying the whole body with it is needed from or demand from oxygen and nutrient and material. So the major artery in our body, it's starting from the aorta. So ascending aorta is there. Then the branch, the arch of the aorta here, the arch of the aorta. From the arch, from the base of the aorta, the first thing which is coming out from it, first branch, is the coronary artery that supply the heart muscle with its need from oxygen and the nutrient material. So the heart is taking its need from the first, from the beginning or from the base of the aorta. So those branches are coming out from the beginning of, from the first part of the ascending aorta. Then we have the arch of the aorta. From the arch of the aorta, the brachiocephalic artery are coming out from it, right and left brachiocephalic artery. And from that artery, there is the common carotid artery are coming out from it also. And the internal and external carotid artery, those are the internal and external carotid artery. Then vertebral artery, right and left vertebral artery. So those are the major artery that coming toward the brain. If we are taking section in to see the blood supply to the brain. So this is the frontal lobe of the brain, and this is the cerebellum here. So see the network of blood vessels which supplying the brain, because the brain is in need for also a good blood supply in order to work well and to let the whole body working properly and maintain the proper work of our body. So here the pituitary gland, and see how many arteries are coming there. This is the base of the brain from downward. And those are the blood vessels. We will come to the name of those blood vessels. So the arterial supply of the brain, it is coming from those artery, which is the vertebral artery. Then the basilar artery is coming from the vertebral artery, and here the posterior cerebral artery is a branch of it. This is internal carotid artery, right and left internal carotid artery, and this is the medial cerebral artery, which is coming from the internal carotid artery. It will go to the middle of the brain. The anterior cerebral artery also are coming from the internal carotid artery, and there are communicating artery in between. So joining the blood vessels or the arteries to each other. See here, communicating arteries are there in order to make what we call it, make a circle, make a circle of Wells. We call it the circle of Wells. In order to keep the blood supply to the brain from any from all sides. So if there is diminished blood supply from any of those artery that's coming to the base of the brain, the other artery will take the action, and it will give the blood to the branches of the arteries that is going to the brain. So because it is going in a circle. So let us say that if this artery is closed, so the blood is coming from this artery, or it will be coming from the other artery, which is the vertebral arteries, in order to supply the whole brain with it is needed, or it is demand from oxygen and nutrient. The major arteries here, we have the aortic, as we said, the aortic arch, then the brachiocephalic artery, this is called the brachiocephalic artery, common carotid artery, again, and internal and external carotid artery, vertebral artery, subclavian artery, and then, so this is the blood supply to the extremity, subclavian artery, which is coming under the clavicular bone, and then axillary, it will go from under the axilla. Then this is the brachial artery. The brachial artery, then it will be divided here to two branch, the radial and ulnar branch. So radial and ulnar, radial toward or beside the radial bone, and ulnar beside the ulnar bone, which supply the hand. Then here there is what we call it the palmar arch, which is connection between them. And here we have those digital arteries, which is coming or supplying giving the blood supply to the fingers. So the blood supply to the upper extremity, we have from the arch of the aorta, subclavian artery, then from subclavian artery we have the axillary artery, the brachial artery, the radial and ulnar artery, then the palmar arch, and the digital arteries. It is the same in both sides in both hands, in the right and the left. The cerebral circulation, or the circle of Wills, the circle is connecting a blood vessel at the base of the brain. So it is a connection of blood or arteries to supply the blood to the brain in a proper way. So the major artery are joined by communicating artery. So there are communicating artery that join the four main arteries together in order to keep a continuous supply of blood to the brain. The function is protect the brain by providing more than one route of blood. So if any route is having diminished blood supply, then the brain will take its needed blood or needed nutrient and oxygen from other branch of the blood vessels. And then from the major artery, the aorta, it will come down to, after the arch of the aorta, there will be the descending aorta that will come to abdominal aorta. In the abdominal aorta, there is the celiac trunk is there, here, and left gastric artery and splenic artery are coming from it. So splenic artery and gastric artery are coming from the celiac trunk of the abdominal aorta. Then we have the common hepatic artery. Common hepatic artery which supply the liver. Superior mesenteric artery, the superior mesenteric artery, this artery will supply the intestine and the viscera. The renal artery, right and left renal artery, supply both kidney with its blood, and gonadal artery, which supply the gonads in our body, and inferior mesenteric artery is there. Then it has divided to two branches, the common iliac artery, both right and left common iliac artery, because it is toward the iliac, beside the iliac crest, iliac bone. So, and then when it is going from the common iliac artery, we have the external iliac artery and the internal iliac artery. External iliac artery and internal iliac artery. Then the femoral artery is coming down to the artery. Then popliteal artery which is coming here behind the knee joint. Anterior tibial artery beside the tibial bone, and posterior tibial artery, one in front and one on the back. So anterior and posterior tibial artery. Then the dorsalis pedis artery and the arcuate artery here. So this is the blood supply to, or the main blood vessels that's going to the lower extremity. So in the lower extremity, we have the common iliac artery. From the common iliac artery, then we have external iliac artery and internal iliac artery. Then this is the femoral artery, because it's near to the femur, take its name from the bone of the femur. Then we have popliteal artery here at the joint, and we have the anterior and posterior tibial artery. Anterior and posterior tibial artery. Then at the foot here, we will have what we call it the dorsalis pedis artery, and here we have the arcuate artery. Arcuate artery, then small branches which supply the tissue. Then we will come to the major veins of the body. So the major veins, those veins, they are returning back the blood to the heart, to the right side of the heart. So we have the skull, we have the dural sinus. It will drain the blood to the external and internal jugular vein and vertebral vein. So we have the dorsal sinus here, and those drain to external jugular and vertebral vein and external jugular vein. So this is the blood return back from the brain. It returns through the external jugular vein and vertebral vein and internal jugular vein. It will be drained to subclavian vein. So it will drain to subclavian vein, then brachiocephalic, and from the brachiocephalic to superior vena cava. So the dorsal sinus, those veins, they are taking the blood from the brain to external jugular vein, and vertebral vein, internal jugular vein, and then they will come to subclavian vein. From the subclavian vein, the blood will go to brachiocephalic vein, then to the superior vena cava, and from the superior vena cava, it will go inside the right atrium. So it will be returned back to the right atrium in order to get its cycle again. There is aortic vein also, it is not shown here. The greater cardiac here, the blood or the venous return from the heart, it is coming through the greater cardiac vein. About the extremity, upper extremity, there is starting from digital vein here, going back to radial vein and ulnar vein. From radial vein and ulnar vein, there is also junction here between them, connection between them, which is the medial capital vein, and this is the basilic vein, and then brachial vein is there also, axillary vein, and those will drain to the subclavian vein, and from the subclavian vein to brachiocephalic vein, from the brachiocephalic vein to superior vena cava, and then to the right side of the heart to right atrium. So from the digital vein to ulnar and radial vein to medial capital vein and the basilic vein and brachial vein. All of those they will drain to axillary vein, then to subclavian vein, then to brachiocephalic artery, and the brachiocephalic artery it will join to the superior vena cava to return the blood to the right side of the heart. About the major veins in the lower extremity. The major vein from extremity is coming from dorsal venous arch. Then we have anterior tibial and posterior tibial vein, anterior tibial and posterior tibial vein, popliteal vein. They will join to popliteal vein, then they will join to the femoral vein, and we have also the greater saphenous vein. This one also is taking blood from lower part of the body, the extremity upward. So both the anterior tibial, posterior tibial, and the greater saphenous vein, they will join here to the external iliac and internal iliac vein to they will supply their back flow to the internal external iliac vein, and then it will join to the common iliac vein, then to the inferior vena cava. It will go back to inferior vena cava. So again, the dorsal arch, and from it will go up through three veins, from anterior tibial through posterior tibial and the popliteal vein. So those are the three veins that return back the blood up from the lower extremity. Then here, the anterior tibial and posterior tibial, it will join to the popliteal vein. After that, when it is coming up, it's called the femoral vein. Here, the greater saphenous vein, it will join with the femoral vein at the iliac, external iliac vein. The external iliac vein, it will join with the internal iliac vein to form the common iliac vein. The common iliac vein, it will join to vena cava inferior. So it will join to vena cava inferior. So the common iliac vein here, this is the right and this is the left common iliac vein. It will join to inferior vena cava, here the inferior vena cava, and there is a gonadal vein which is also not shown here, it's not apparent. The renal vein also, it will directly go to the vena cava also. So those are the major veins and major blood venous return to the heart from the lower limb. The arterial supply of the brain, as we said, it is if lack of blood supply to the brain, even for a few minutes, it will cause a delicate brain to die. So within a few minutes, the brain cell will die, will deteriorate and become necrotic, and it will lose its function if the blood supply to the brain is becoming low. Because of that, we mentioned that there is a cycle of wells, so the blood supply, it is coming through four major arteries there, and they will be joined together with a connection artery in order to make a circle that will permit the blood to go through it from any of those arteries. So this is again the circle of wells, so which is composed from the middle here, the middle cerebral artery, and the anterior communicating artery is there. It's anterior cerebral artery here, and posterior communicating artery, this one, which is coming from the posterior, because this is the posterior part of the brain. Posterior cerebral artery, basal, this is the basal artery, this is the bones, this is the occipital loop of the brain, this is the vertebral artery, two vertebral artery are there, so those are the vertebral artery, and this is the internal carotid artery, both right and left, carotid artery, internal carotid artery, and also right and left vertebral artery. They are joining together to form a circle, and that circle, from that circle, the blood supply to the whole brain, it is coming. So if any delay or if any problem with any of those four major blood vessels, the blood, it will be going from the others toward to the brain cells. So this is the pituitary gland here. This is the internal carotid artery, and right and left, and this is the middle cerebral artery. So all of them, they are joining together through communicating artery in order to make a circle, and that circle, it will help the brain to get its demand from oxygen and nutrient. So the circle of will, it is surround the base of the brain. It protects the brain because it provide more than one route for blood to each of the brain tissue in case of clot or impaired in the circulation. So any impairment in the circulation in the one of those main four artery, it will be supplied, the blood will be supplied by the other. So it will not stop to reach the brain and the brain tissues. The other is the hepatic portal circulation, which is, it is coming from, for the venous return, this is the inferior mesenteric vein. This is the splenic vein, and here superior mesenteric vein, hepatic portal, they will join to form the hepatic or portal vein. The gastric vein, the portal vein, it will go inside the liver. So in order to deal with the content of the blood before it is going back to the heart, then from the portal vein, it will go to inferior vena cava. It will go to inferior vena cava. So this is the hepatic circulation. So the liver, the hepatic circulation, we have the superior mesenteric vein, which is taking blood and nutrient from the intestine and from the mesenteric. We have the pancreatic, this is the pancreas, this is the inferior mesenteric vein, and this is the splenic vein, this is the left gastric vein. So they are joined to will go to the hepatic or circulation or to the liver. So next session we will review the physiology of the circulation, inshallah.